Good afternoon, and thank you for joining us for a special Facebook Live focused on our COVID-19 response. Today, we are talking about food share and healthcare, health insurance. We are joined by Bureau of Enrollment Policy and Systems Director Rebecca McAtee. She is our food share director. And Olivia Huang, Director of Public Affairs for the Wisconsin Office of the Commissioner of Insurance. Thank you both for being here. And let's dive right in with opening remarks. We'll start with Rebecca McAtee.
Good afternoon, everyone, and thanks for joining us today. My name is Rebecca McAtee, and I am, as Elizabeth mentioned, the Director of the Bureau of Enrollment Policy and Systems within the Division of Medicaid Services at the Department of Health Services. I've been working with the Medicaid program for over 10 years and have a master's degree in public affairs from the University of Wisconsin-Madison and have been doing policy work for several years within my career. So I have been working on the food share program in particular for the last 4 years and direct all of the eligibility and other program requirements for food share and for Medicaid eligibility for the state. Just some background currently as it relates to our current status with food share. One of the reasons we're talking about this today in particular is because DHS has seen a 129% increase in food share applications in the last 6 weeks since the public health emergency of COVID was declared. So we know that there are people who are in need of benefits. While we haven't seen a matching rise in Medicaid applications yet, we know that we will probably see a rise as unemployment compensation applications and other changes to our economy are happening. So we want to talk a little bit today about those benefits and changes that may be happening during this emergency.
All right, thank you. And we also have opening remarks from Olivia.
Hi, I am Olivia Huang. Thank you for that introduction. So I am the Director of Public Affairs at the Wisconsin Office of the Commissioner of Insurance, and we're the state agency that really focuses on regulation of insurance companies in Wisconsin. In particular, when it comes to health insurance, there are some health insurance companies that we get to regulate, and so we are there to provide information and support to consumers, and we are there to handle complaints as they come up. I've been working in government and in and around public health for roughly the last 15 years. At the Office of the Commissioner of Insurance, I get to work on our legislative strategy as well as working on consumer information and education. And really, one of the highlights of that is getting to work with the folks who help people enroll in health insurance. So navigators at organizations like Covering Wisconsin and the Community Health Partnership in Outagamie County, the Milwaukee Enrollment Network. And these folks, these resources are really sort of the cornerstone of how we help folks find health insurance that meets their needs and is affordable. So we'll talk a lot about Covering Wisconsin and coveringwe.org. We'll talk a lot about 211, and we'll talk a lot about resources like the Medigap helpline that help folks who enroll in Medicare.
All right, wonderful. Thank you both so much. Let's dive right in. Our first question comes in about health insurance. I want to remind everyone, though, that Medicare is a federally administered program. The state does not have a role in that, so we're not addressing Medicare questions today. However, we are talking about Medicaid. We're talking about private insurance. And the first question comes in from Abby, who says, I lost my health insurance. I don't know if I qualify for Medicaid. How can I find out, Rebecca?
Yeah, great. A good question. So we have lots of different opportunities for people to apply and to find out more information about the different benefits that are available within the state. So probably the best option is for people to go to our access.wisconsin.gov website. This is our access application, and it's a fully integrated online application where you can enter your information and apply for benefits above and beyond just Medicaid. You can apply for Medicaid, you can apply for food share, you can apply for childcare, all through one integrated application. Another option that's on that website, the access.wisconsin.gov website, is we do have an opportunity for individuals to enter some minimal information to check and see if you are eligible without having to submit a full application. So if you're not sure if you're eligible and you just want to see, you can go out to that website and check that box that says, check to see if I'm eligible. And you can enter some very minimal information to see if you might be eligible for one of our programs. Other opportunities to apply for benefits, you can call your local income maintenance consortia, county or tribal agency. And all of that information is also available out on the Wisconsin, DHS Wisconsin website under Forward Health IM agencies. And we can make sure that the links for all of these different websites are available on the Facebook feed following today's call.
Wonderful. And Olivia, then the question came in from folks. I'm going to put a bunch of questions together for you because they're very similar. If I don't qualify for Medicaid, what are my other options? My family didn't have health insurance before COVID, but I'm really concerned. I would like to get that health insurance now. We're not low income, but we're not rich either. Carrie Ann just posted about that as well. What should I do? When can I enroll in coverage?
Yeah, those are great questions. And really, there are a couple of different options. So, I'll sort of start off by saying, and in particular, if folks have to jump off of this Facebook Live at any point in time, there are, like we mentioned at the beginning, some resources for you. So the Covering Wisconsin, the 211, those organizations can help you figure out what you qualify for. So for example, if you had employer-based health insurance and you lost that health insurance as a result of losing your job or having your hours cut below a certain threshold, you may have an option to enroll to stay on your current health insurance using a federal option, a federal requirement called COBRA. Basically means you get the ability to take your employer-based insurance and continue on with that for up to 18 months. That's a good option for some individuals who may have certain plans where they've paid all of their deductibles so far for the year or all of their cost sharing so far for the year. And so that might be an option for some individuals, but I'll caution folks that that can be really expensive. So it's really important to take a step back and look at what options you have. One of the things we'll talk a lot about today is something called the federal marketplace. And the marketplace is really, for most intents and purposes, a website run by the federal government that compiles all of these health insurance plans that meet certain criteria. So you can't be denied if you have a pre-existing condition. Those health insurance plans have to provide certain essential health benefits. And so these are really good options for you. You can get an individual plan on the marketplace, or you can get a small group plan or a small employer plan on the marketplace. So you can also purchase insurance off of the marketplace if you want to go directly to an insurance agent. But the advantage of going to the marketplace and using 211 or Covering Wisconsin or going directly to healthcare.gov is that you may be eligible for something called an advanced premium tax credit. And essentially what that means is you have your insurance premium and you can choose to apply essentially payment assistance or premium assistance to that premium in a couple of different ways. You can apply it so that it reduces your monthly premium from month to month. You can apply it so that you get a tax credit at the end of the year. You've got a couple different options, but it really depends on your personal situation. And so I encourage you to take advantage of that. Now, if you didn't have health insurance before COVID-19, if you don't have health insurance that you lost as a result of a change in your job, you may still have the ability to enroll in a health insurance plan on the marketplace. If you, say, for example, had a baby or adopted a child, if you moved, you had a change in your income that meets a certain criteria. A health insurance expert, a navigator, is going to call that a qualifying life event. And a qualifying life event just means you meet those certain criteria. If you do, then you have a window in which you can apply for health insurance on the marketplace. The really important part is that from the time that you have a change, say you lose your employer-based health insurance, or you have a change like you have a child, or you make a move, you only have a 60-day time period in which you can apply for insurance on the federal marketplace. So that's really important. Other than that, there's an open enrollment period that happens in the fall. But right now, for folks, the important thing to know is if you don't have health insurance right now, if you lost health insurance recently, you've got to take action as quickly as possible to make sure that you get all of the options that are available for you. And like Rebecca said, you may be eligible for Badger Care Plus. There is no time when you have to sign up for Badger Care Plus. So making sure that even if you think you're outside of the window, that you still get help from an expert and you still apply to see what you may be eligible for, because you won't know really until you go through this process.
All right, Olivia, thank you. And Rebecca, we had similar questions when it comes to Medicaid. Are there any changes to eligibility or coverage because of the pandemic that I need to know about?
Yeah, another great question. There are definitely some changes that have been happening for people who are currently eligible for the program in particular. So one of the things that has been passed at the federal government level through some of the legislation over the past couple of months has been a requirement for individuals to not lose their healthcare coverage if they are currently covered under Medicaid, Badger Care Plus, or any other healthcare programs under the Medicaid kind of Forward Health umbrella within Wisconsin. So we are currently not terminating anyone who is eligible for the program as of March 18th of this year. No individuals would be terminated for healthcare. And that is going to happen until the emergency is over at a federal level. So that is a big change, obviously, and something that we are doing within our system. Some other changes that we are doing on a policy side is we are really looking at ensuring that we are supporting individuals and making sure that our processes are as streamlined as possible for any kind of applications that are happening. And also looking at ensuring that we're maintaining that coverage for individuals who are currently covered through our Badger Care Plus and other healthcare programs that are funded at the state or federal level. So one of the other major changes that we're making is we recognize that new applicants for the program, they may not have access to some of the materials that we usually require for verification of certain certain things, such as employment or rent checks or anything like that. And so we are streamlining some of those requirements to ensure that we are using the best available information that is possible for us, and allowing good cause if people are not able to verify some of that information because their business may be closed or their employer may not be able to get information. And then some of the other changes that are happening are that we are also looking at the suspension of premiums, for example. Knowing that this is a time where it's a hardship for several families to be able to afford paying those premiums, is that we have suspended premiums and the requirement for premiums to be paid for Badger Care Plus, children and families, as well as MAP, which is another one of our programs, the Medicaid Assistance Premium Payment Program. So.
And when we talk about the coverage, we got testing questions. Someone wrote in and said, I'm on Medicaid. Do I have to pay for a COVID-19 test?
No, at this point in time. So there currently are no copays. And again, for those who to understand what copays are on the Medicaid program, copays are minimal amounts of funding that members would pay at the time of a service. Generally, this is between 50 cents and $3 for a service. And we currently have no copays right now during this time period. And there will not be any copays for COVID.
All right, and Olivia, that's a little bit of a different answer when it comes to private insurance, correct?
Yeah, it really is. So, the answer varies for individuals based on the insurance plan they have. And it really can vary to a certain extent based on, if you have a high deductible plan versus if you have a plan where you're doing cost sharing on a regular basis and paying a copay when you go in. So really what we advise folks to do at a very basic level is, if you've got questions, call and talk to your insurer. The Act 185 that the governor recently signed into law requires that the actual test itself for COVID-19 is covered by insurance plans without any cost sharing. But if you normally have a charge that you pay when you go in to see the doctor or to urgent care or to the emergency room, under your normal insurance, those things may still apply. Some insurance companies have said that they are covering cost sharing in certain circumstances. for the COVID-19 test, but it really, again, it really varies between insurance companies and it really varies between insurance plans even. So having that conversation is really important. You know, at the end of the day, if you feel like something should be covered by your insurance and it isn't, and you've tried to have that conversation with your insurance plan, our office, the Office of the Commissioner of Insurance, is here to help support you. We have a complaints team, a consumer affairs team that can help answer questions and honestly can help navigate the relationship between you and your insurer sometimes if there's a disagreement. So we have a complaints website where you can submit those complaints online. We also have a 1-800 number. It's 1-800-236-8517. And that's a really good resource for you if you need to come and contact our office and get some additional information.
And Olivia, we talked about testing, but about supplies. Will insurance cover supplies like gloves or masks or disinfectants?
Yeah, so the short answer is no, unless your doctor has determined something to be medically necessary. So under normal circumstances, if you have a supply that's a part of your treatment plan with your physician, your insurance may cover that. But under sort of the normal course of business, if I'm going to go purchase gloves or masks in order to protect myself and my family, those are likely not going to be covered by my insurance or by other folks' insurance as well.
All right, good information, thank you. We do have two more marketplace questions that came in, so we'll start with Olivia on these. The first, will I be penalized for not reporting that my job is on hold? And if yes, should I update with my unemployment information?
Yeah, so I'd say the first thing I want to point out is that it's really important to always be upfront when you're filling out applications, whether it be for the federal marketplace on healthcare.gov or you're working with someone to apply for insurance. Be upfront about what's happening with your job at this particular moment. Current income is really important. And when you work with someone like a healthcare navigator or an insurance expert covering Wisconsin or at 211, they can really help you figure out what you're supposed to put down in terms of your income. The Department of Workforce Development does have some guidance on their website about how to categorize exactly what your employment status and your income is. And I really encourage folks to take a look at that. You can try and grab that link and put it in the comments below after this feed. But, income loss, even if, say, for example, you still are technically employed, but you have reduced hours or your office place is closed, you may still qualify for an advanced premium tax credit. On the marketplace, you may still qualify for other programs and criteria. I know Rebecca could probably talk more about what that means on the Medicaid side of things, but be upfront, answer that information, and chances are there's a resource that we can help sort of navigate you to, and those resources like 211 and Covering Wisconsin will help you figure that out.
Wonderful. And the second question came in and said, I had health insurance from my job, but now that I'm not working much, I had to get a plan from healthcare.gov. So when I go back to work, will my deductibles start from zero or will they pick up where I left off?
It's a really important question. So if you lost your employer-based health insurance, the simple answer is, and you are no longer on that insurance, if you go back to your employer and you get the same insurance plan, you will be starting fresh. You will be starting from zero. That means you're starting over on deductibles, you're starting over on cost sharing. That's one of the reasons why for certain individuals, staying on your employer-based insurance, using the COBRA option, if that's available to you, might be something that makes sense for folks who have a high deductible plan and they've paid that deductible out for the year. That may be something that makes sense for them. It's one of those questions that a health insurance expert can help you navigate based on your personal circumstances. And so they can help you figure out what makes sense. But again, like we talked about earlier, COBRA can be really cost prohibitive. It can be really unaffordable for a lot of folks. And so looking at your options to see if maybe you qualify for Badger Care Plus, or maybe you qualify for a health insurance plan on the federal marketplace, and you get some assistance with that premium using an advanced premium tax credit. Those are really good options. And, it's great to have that deductible paid off. But one of the things that we know is that life is really unpredictable, right? So while you may be able to go back on your employer-based insurance at some point in time, if it's a possibility that that doesn't happen, it really makes sense to explore all of your options.
All right, good information. Thank you. Rebecca, the next question is about food share. I don't receive food share, but I need to now. So how do I apply, and do I have to do that in person?
Yeah, great question. So again, food share is one of those benefits that is available to individuals, especially during a time where they may have lost employment or have a reduced income. So applying for food share is the same process for applying for Badger Care or other benefits. Again, our access.wisconsin.gov website is an integrated application that allows you to apply for several different benefits in one application. You do not need to apply in person. In fact, we would tell you not to apply in person. And to support that, we do have call centers that are available through your income maintenance consortia again, and we will have that link available so you can find your local county agency or income maintenance consortia and the information for those groups. But you can apply over the phone. You can call your income maintenance consortia with questions around food share and food share benefits. And they can support you with an application over the phone, or if you have questions about the benefits and about any kind of questions around how to apply. The other component with our income maintenance agencies is that most of our income maintenance agencies are working remotely. And so lobby services, in-person services are not available at most consortia. But if you do have a question around how you can get some services in person if necessary, you can call your county consortia and they can also tell you what services are available and make an appointment with you if there is a service that they are able to offer in person.
And we've gotten questions from folks who are already food share members. Brian and Jennifer wrote in and said, are they giving an emergency food share benefit for the max this month like they did the other two? Are we extending food share maximum benefits like other states are?
Yes, so actually a great timing on this question. We received approval this week from the Food and Nutrition Services at the federal level to provide emergency allotments for the month of May. And just an explanation of what emergency allotments are. This was authorized also under the Families First Coronavirus Response Act to basically allow families who are currently receiving food share to receive the max allotment for their household size. So individuals would receive an additional amount of funding above and beyond what they normally receive for food share on a monthly basis to get them up to that max allotment if they aren't already receiving the maximum amount. For May, these benefits are going to be provided the weekend of May 23rd and would be available on members' cards on May 24th. And to be eligible for the maximum allotment in May, individuals must have ongoing benefits for the month of May.
And you've talked about this a little bit. Susie just wrote in and posted, how do Badger Care recipients receive the food share dollars?
So if Badger Care recipients want food share dollars, they would have to actually apply for food share if they are not already on the food share program. So if you already have an open and ongoing case for Badger Care Plus, you can go into Access and log into your My Access account and just do a program ad, which would be applying for the food share program with some of the information that you may have already provided for your Badger Care Plus application. So you do have to actually be a food share recipient in order to receive that food share money. And so you would have to apply for the program itself.
And Rebecca, we have more questions when we're talking about schools. We've gotten a lot of questions from folks. I heard there is more money available to us because school is closed for the rest of the year. How do I know if my family qualifies? Is it automatic if my child receives free and reduced lunch at school? What if my child does not receive the free and reduced lunch at school? Can I get the benefits now? You know, how do I apply? When do these start? How long will they last?
Great. So a lot of questions, and this is a very a new program, again, authorized under the Family First Coronavirus Act and the CARES Act from the federal government. This is something that people may have heard of as pandemic EBT or PEBT. And this is a partnership between the federal USDA Food and Nutrition Services programs and our school system here in Wisconsin. We were approved to be able to provide pandemic EBT for families who have children who are currently receiving free and reduced price meals through the schools during the school year. And this is basically to allow those families whose children are receiving those free and reduced price meals during the school year to have some additional funding while those children are home and schools are closed. So the eligibility for this additional funding is not driven by eligibility for food share or for any other programs. It is truly driven by the family participating in the free and reduced price lunch or meals program through the school districts that are participating in the National School Lunch Program. So that is where eligibility for the program lies, is actually having those families applying through the school districts themselves that are are participating in the National School Lunch Program, or being eligible for free and reduced price lunch through one of those schools through a process called Direct Start. So the way that the department is issuing benefits to people is that we are looking at information across multiple data sets to try and match individuals based on the information that we know. And we will be automatically providing benefits for certain families depending on the information that we have on file. So for food share recipients who are also have children participating in a free and reduced price meal program that where the school is actually participating in the National School Lunch Program, those food share recipients who are current active food share recipients would have received their benefits for their children last week. We did our first round of allotments out to families on April 26th, and those were available on individuals' cards on April 27th. We know that there are lots of questions around this, and there is another a round of allotments that are going out automatically this weekend for families that may participate in other programs, not just food share, individuals who are known to our systems or that we have information about, whose children are also receiving free and reduced priced meals. But they may not be receiving food share today. They may be on Badger Care Plus, for example, or receiving child care benefits from the state. We are going to be doing another round this weekend to get those benefits out to those families through the system. Then after this weekend, we are going to have an application process for those families who may not have been able to be matched across our programs and be issued these benefits systematically. Those individuals who are going to be able to apply, the school districts will be reaching out and communicating to those families about their about the application process and for those families who are eligible to apply. And again, I just wanted to note that it is not your eligibility for food share or other programs that drives the eligibility for this money. It is your eligibility for free and reduced price meals that your children may be receiving through their school district during the school year.
Wonderful. We're getting a lot of questions about that, so we will put some links up on Facebook as when we're done with this. The next question, though, we're going to send over to Olivia. Many preventive routine procedures like mammograms, dental visits, et cetera, need to be done within a certain time frame during the calendar year to be covered by insurance. Some of those procedures have not been allowed. They were non-essential. When they are rescheduled, the cost may not be covered. Have there been conversations with private insurance companies to cover these routine visits that couldn't take place when we had some of these businesses and clinics closed?
Sure. So first I'll say that the Office of the Commissioner of Insurance has been talking to health insurers about how they are making accommodations for their the members, for the folks who have insurance through them. So we're asking them things like, what are you doing to be flexible with premium payments? What are you doing to be flexible with certain other criteria for folks, making sure folks can stay on their insurance? When it comes specifically to how a particular procedure is covered or the time frame in which it's covered, really varies from insurance company to insurance company. And I will say one important thing to note is that even though we regulate the insurance industry in Wisconsin, there are some health insurers that we don't have the ability to regulate. A lot of those are regulated at the federal level under the Department of Labor. And so when we think about how to navigate this, if you're going to try and figure out what's going to be covered for you and your family, the best thing to do is to reach out to your insurer and ask those questions. So whether it's dental insurance and you are trying to get your regular cleaning scheduled and filled, or whether it's a mammogram that's a preventive service, reach out to your insurer, ask those questions. If ultimately you're unsatisfied with that answer, you disagree with that answer, you think you're not able to get access to the care that you need, do call us. Again, our website has a complaints section that you can utilize. We also have a 1-800 number, and that's the 1-800-236-8517. And we can help you navigate that conversation between your insurance company and yourself.
And we also have prescription questions. Can I receive my prescription refills early? Can I receive a larger quantity of my prescription than I'm typically allowed?
So, our goal is to make sure that everybody can get access to the medications they need while staying safely at home. Under the new law, Act 185 that the governor signed into law recently, you can get up to a 90-day supply of most of your prescription medications. There are some exceptions to that for controlled substances, but really the goal is to make sure that you can receive those. And in some certain circumstances, you may be able to receive them early as well.
We also have a telehealth question. Olivia, will telehealth services be covered by my insurance?
So, it really, I feel like I say this a lot right now, it really does vary from insurance plan to plan for each individual and each set of circumstances. I wish it was one answer for everyone. It's a big priority for the governor. We know it's a big priority for our office as well. So early on in the pandemic, we asked all of the insurers in Wisconsin to cover anything they would normally cover in person. We asked them to cover that as a telehealth service. And so there are a lot of insurers who have seen the value in this and are doing this, and some were doing this even before the pandemic. And so what we have seen is that a lot of folks are having access to this. If for some reason you access a telehealth service and your insurance company says they won't pay for that, they won't cover it, call us, file a complaint with us, and we can help facilitate that conversation. But this is something that really reach out to your insurance company, ask those questions, and try and get as much information as you can on the front end. I apologize for my doorbell in the background, guys.
Everyone is working remotely and staying safer at home, so we appreciate you participating. And we, of course, have gone over time, as we typically do. So I'm going to ask Rebecca, do you want to say anything about the last question on telehealth, and do you want to go into your closing remarks, please?
Sure. I can just very briefly touch on telehealth. The department for our healthcare programs and our Badger Care Plus programs, we have issued a lot of different guidance around telehealth and have expanded our services to allow for telehealth in several different benefit areas. So while I'm the eligibility person and not the benefits person, I can just tell you that our Forward Health portal does have information about what services are available via telehealth. But again, if you have a question, you should work with your provider if you have a question about what services are available. And then with that, I will go into closing remarks. I recognize that 30 minutes is not enough time to really explain what's happening because there are a lot of changes happening during this time. And I just wanted to also put in a plug. We are putting a lot of information out that is related to COVID on our DHS Wisconsin.gov website related to COVID. And then also recognizing that that any changes in eligibility policy for food share and for Badger Care and Medicaid programs have an immediate impact on families, and there generally are a lot of questions. These are very complex programs, and so we at the department have initiated a stakeholder call series. And we are doing that stakeholder call at noon on Wednesdays every other week. And we are taking a multitude of topics. So any topics that people may be interested in that touches on either food share or on Badger Care or Medicaid eligibility, we are capturing that information to be spoken to at these calls. So recently, we've only been talking about COVID and the COVID emergency response, and then after those stakeholder online. So that's a great opportunity to keep up to date on changes that are happening, as we recognize that changes are happening very rapidly right now. And we will make sure that we have the link for those stakeholder calls also included after today's discussion.
Wonderful, good information. Thank you. And Olivia, closing remarks.
Yeah, well, first, thank you so much for giving us even just a 30-minute window to do this. I want to just say, you know, health insurance, if you don't have access right now, if you've lost access recently, if you haven't had access in years, haven't had coverage in years, now is really the time to make sure that you can find a resource that works for you, an affordable plan that works for you. Your health is so important, not just for yourself, but for your family and your community. So we're here to help you. There are many organizations around the state that are here to support you and to answer your questions. I want to just, again, put in a plug. Covering Wisconsin, their website is coveringwi.org, is a great resource. They can help you find a health insurance plan. If you end up qualifying for Badger Care Plus, they'll push you into that system so that you get signed up that way. You can also call 211 and they've got other resources available. And then if you are Medicare eligible, you may also be able to get some assistance from the Medigap helpline, and they can help you with things like Medicare Advantage plans, understanding prescription benefits. But now is the time. There's that 60-day window. And so taking action right now is going to be the best thing to make sure that you have the insurance coverage and the access to healthcare that you need.
Thank you, Olivia, and thank you, Rebecca, and thank you to everyone for sending in your questions. We will post links to some of the sites we talked about during this Facebook Live at the top of this post. Just give us a few minutes to get that done. And then remember, you can always find the latest information right here on Facebook and on the DHS website. We have several pages devoted to COVID-19. Just log on to dhs.wisconsin.gov, and we'll see you next time.